Well, good morning, everyone. My name is Sonny Gurney, founder and principal of 4TBrokerage. I want to thank you all for joining me today, and I hope that you find value with the information I'm about to share with you. My expectation is that over the next 30 minutes or so, you'll get a better understanding of the role of an FMO, why more transparency is needed, and why I want to help you understand the potential loss of renewals without a succession plan. I'm confident that my story will resonate with many of you here today, and I hope that we can bring change to the industry. Now, due to my conflict in my schedule, I had to pre-record this presentation and I won't be able to take live questions. However, I have a couple staff members that are attending the 4TBrokerage virtual booth. So if you have any questions or you want to set up time to discuss your situation, please feel free to reach out to Stephanie and Sandy. I want to take a quick second just to thank each of the board members of Madahu. They did an amazing job of preparing and coordinating everything so that we could have this successful event. Obviously, you have my information here in front of you. My cell phone is 248-330-5102. So today I want to talk to you a little bit about the truth about contracts by telling you my story. I assume that my story will resonate with many of you. The transparency from an FMO, succession planning, are you prepared? And then what does 4TBrokerage offer? I've got a few slides that explain what we do that separates us. But if we have enough time, I also want to take a minute to kind of go through what's called 4T Connect. It's our agent portal that is a great resource for our agents to help them sell more faster. So I want to tell you a little bit of my story because this is who I am. This is the heart of who 4TBrokerage is. This is the passion that I bring to everything that I do. So I'm very transparent in my conversations. So go back to 2003. I was in a dead-end job. I didn't have a college education. I was working as a printer. I was working 40 hours a week. Anytime there's available overtime, I took it. If there were any part-time jobs that I could do, I was doing volleyball officialing. I was doing central vacuum installations just to pay the bills. So I wasn't afraid to work. And what happened is I got to a point where my wife and I were expecting our second child. Our grocery budget for the week was $35. And I was working crazy hours and I knew something had to change. So there was a buddy that I went to church with who had nice cars, nice clothes, nice house. Didn't know exactly what he did, but I knew that he was in sales. And I was like, you know what? I've got a good personality. I like dealing with people. Maybe sales is an opportunity for me to improve my financial situation and give me a career. So I started working in the final expense industry in 2003. I started in Rochester, New York, which is my hometown. And a year into working for a company called American Income Life, my boss was offered the territory of Michigan. He asked me to move out here with him to help expand, help train, bring our systems out here. We went from 2 offices with about 30 agents to 5 or 6 years later, we had 120 agents. We were in multiple states, 6 or 7 offices. And I enjoyed what I did there. However, it got to a point where it was the same old, you got to hit these certain numbers to qualify for a bonus. And they just were unrealistic. And so what I did is I ended up moving away to Baltimore for a couple of years and had an agency there. Moved back to Michigan in 2013, and then a buddy of mine, Dan, that worked with me at American Income, was working at FMO called Health Markets. They're national. They've got an office in Southfield, office in Grand Rapids somewhere, and he came to my house and did my health insurance. I started asking questions about, leads, product, commissions, how everything worked. And in 2013, I joined Health Markets. New to health insurance and Medicare. I didn't know anything about it, so I liked the structure that they had there. However, my goal going there was to build an agency, and I liked Health Markets because it just had a cookie cutter mold, and it just was very simple to plug and play. But what I found out very quickly within 6 months is that I was paying more for leads that I could do on my own. I was losing about 40% commissions for the value that they brought. And for me personally, I realized I didn't need their support. So what I did is I interviewed with a couple other local agencies, and basically I told them my goal was to own my book of business, and I wanted to get paid street level commissions. So I found a local agency that I went to. They said, "Yep, you own your book of business. You get paid 100% of commissions." And one of the things I asked for before I joined is I said, "I'd like to see your contract." Now, Health Markets had a very detailed contract, and I mean, it was layered deep within their website, but they had a contract. It was very clear, distinct. You knew that you didn't own your book of business. If you left there, you knew that you were going to lose a percentage of your commissions for admin fees. But when I went to this other local agency and they told me I could own my book of business and I would get 100% of commissions, they didn't have a contract. I'm like, what do you mean there's no contract? I was told that all I had to do was contract with the carriers and that was it. Well, I was like, sweet, that's amazing. I'm going to contract with all the carriers and we're going to get out there and I'm just going to start rocking. Well, that's what I did. I started going through and I did all my contracts and life was good. What happened is the commissions got paid to the agency, and then once a month I got a report from the agency. I got my commission statement, and I just matched up my records and never really had an issue. And any issue that I had, it was always resolved with that agency. Well, what happened is when I started my agency in 2014, it was me and a part-time assistant, and I ended up recruiting a couple of retired agents that, well, they were retired from GM, retired from another company, and they were doing insurance part-time. So they came to work with the Gurney Agency, is who we were back then. And I really liked it. It was a great system. I paid for everything, their office space, their E&O, their leads, everything, and gave them training and support. And we just had a deal that we split the commissions, and everything was going really well. I got to a point, though, where I really wanted to go back to what I was used to, recruiting agents, training agents, giving them support, and then getting higher than street level commissions for working with them. So I went to the local agency I was working with and I said, hey, here's my goals. I want to start recruiting. I want to build an agency similar to what you have. And the only way I can do that is for me to get an override on my agents' commissions. What I was told was that there wasn't enough money to go around and that they could probably share a little bit with some of the carriers, but some carriers I wouldn't be able to get anything. And so I started just looking around and started thinking. I started calling around some of these national marketing organizations and realized that I didn't really need this local agency anymore. So what I did is I left that local agency in the first part of 2018. At that point, I had 3 agents working for me. And I reached out to one of the local carriers and said, hey, I'm no longer affiliated with this local agency. I'd like to be considered for an FMO and Priority Health in 2018 based off of my relationship with them, based off of my production with them, based off of previous conversations. I was able to acquire a GA and an FMO contract. And when I did that and started my own agency, there were 2 agents that I had recruited to this other local agency. And one was at Health Markets with me, and I brought him over, and another one that was thinking about going to Health Markets, and we talked a little bit, said, nope, I think you can do better somewhere else. So these 2 agents left that local agency and came with me to start my FMO in 2018. April 2019, we had about 10, 12 agents working with us, and we started our first recruiting campaign as Gurney Agency it was April 11th, 2019. So we had 12, 13 agents at that point there. Today, we're just over 165 agents, and we've got about 15 to 20 agents that are in the pipeline of getting contracted now. So we're growing very quickly, and hopefully you'll see as I go through who we are and what we do, you'll see why we're growing so quickly. But that's my story. I'll tell you the next step. As an FMO, we now have an FMO contract with Priority Health, with HAP, with PHP, and just recently, last week, I was awarded a GA contract with Blue Cross and Blue Shield. So I'm excited that the local carriers we have direct appointments with, which gives us the highest level of contract with them. And then on the under 65, we've got the GA with Priority Health, we've got the GA with HAP, we've got a GA with Ambetter, we have an MGA contract with Oscar. So we're just growing, and our production speaks for itself. And people ask me, well, what's next? What's next? Well, I'm not sure. When I got into my agency, I didn't think I really wanted to be an FMO. And when I became an FMO 2 years ago, I didn't really think I wanted to be a national marketing organization. However, I see that as my next step, is to become, competition with Gordon Marketing or the Brokerage Inc. out of Texas, possibly, Ritter. There's a lot of great national marketing organizations out there, and I think that's my next step, is to be in competition with them. So here's the truth about contracts, and I'm very passionate about this, and I hope that if you have any questions about your situation, you'll reach out to me, because as I was telling people my story, they could not believe it, they don't want to believe it, and I think that some people still don't believe it. So that local agency that I left, I had some communications with some of their agents, because they reached out to me and said, why'd you leave? What's going on? What are you doing? And what you need to know is that if you assign your commissions to an agency, you just gave up the rights to your book of business. There's no two ways about it. When I got together with my attorney, he had some good words of wisdom with me. He basically said, in our meeting, don't speak. I'll do the speaking for you, because sometimes emotions gets the best of people. And he said, you assigned your commissions. There's not much leverage you have. I mean, you've got a good relationship with the carriers, you got a good relationship with the agency owner. However, you assigned your commissions. They own your book of business. They don't have to pay you a dime. So that's what really got me motivated to find out more about LOA contracts. If you do an LOA contract, you better be getting something for it. And you better have a contract so that if you leave that agency, you can take your book of business with you. Because if you have an LOA contract assigned to your commissions and you want to leave that agency, what happens is your commissions stay there, your book of business has to get reassigned. Most carriers, your book of business gets reassigned to somebody within that agency. So when I left, and I had 500-600 clients, I no longer was the agent of record. I couldn't contact the carrier for these clients. I no longer could see them in my book of business. It was a huge pain. So I became very passionate about explaining to people that with the LOA contract, you better have a very good reason why you're signing an LOA contract. Like, they better be paying for all of your leads. They better be giving you high to street level commissions. Or you need to have some sort of pre-release letter that you can take your book of business and your commissions with you when you leave. Please reach out to me if you don't understand this, if you have questions. But you need to know that in the health insurance and Medicare space, you really want to make sure that you have commissions paid to you directly. The danger is, if that agency is sold and you don't have a contract with that agency, and you do an LOA contract, that new purchaser of that business doesn't owe you a dime. You could have $300,000, $400,000, $500,000 a year in commissions coming in, and if that agency sells it, or the agency owner dies, the person who takes it over, if there's no written contract between you and the agency that is assumed by the new owner, they don't have to pay you a dime. So it's really, really important that you look over your contracts, understand how you're being paid, and make sure that you're doing what's in your best interest long term. So most agencies that are doing LOA contracts, they're very secretive. They don't explain to you that you don't own your book of business. They don't want you to know that you don't own your book of business. And then down the road, if you want to sell your book of business, and guys, with Medicare, you could sell your book of business for 2 to 5 times the value of your commissions. If you've got an agency owner that's willing to buy your book of business when you retire, you're at their mercy. If they want to give you 2 times, that's all you're going to get. So just be very careful. Understand the difference between independent and LOA. Independent commissions are paid to you. You own your book of business. You can sell your book of business to whomever you want. People that are doing independent contracts understand that contracting is going to be very clearly explained to you, and then you don't need a release of book your I'm sorry, you don't need a release of your book of business to go elsewhere because you're completely independent. Okay, so I want to talk to you about creating a succession plan. Why is this not being promoted? Well, quite honestly, most FMOs really don't care about your succession plan because the reality, if I have an agent that writes 500 Medicare policies underneath me and then they pass away, I'm still going to get my residual income off of my overrides. Doesn't mean you're going to get your renewals coming into your family. But what I want to talk to you about is the AHIP products. So your Medicare Advantage plans, MAPDs, or your prescription drug plans. This is where most people are at risk. If you don't have a succession plan, you've got 500 policies on the books, and you pass away or become permanently disabled where you can't complete AHIP product certification. What happens to your residual income? Do you think it goes to your beneficiary or does it go back to the carrier? Well, obviously, based off of my concern, my need for succession planning, this conversation today, it goes back to the carrier. Don't learn the hard way. We had one of our agents pass away last year. Fortunately, we were right in the process of doing the succession planning, and most of everything went well, but not everything. So you've got to make sure that today you think about it. If you die tomorrow, who's going to get your commissions? Better question is, who do you want to get your commissions? Your family, your loved ones, or the carrier? So when you're creating a succession plan, I'm going to give you a couple pointers. However, I have some proprietary material that I'm not going to talk about in public. But one of the things you can do is you can create an LLC, get your LLC contracted, and have commissions paid to the LLC. Now, there are still some risk involved with that. You have to make sure, one, that you have a partner that's either involved with the LLC that can get licensed or is licensed. But if you've got a partnership with your spouse and you guys both die in an accident, you still need to have a succession plan where somebody can take over the LLC and make sure that the AHIP certification is being done, the product certification is being done, so those commissions can keep running in. If this is a concern to you, reach out to me and I'll have a conversation with you. Another way that you can create a succession plan, which is a way that I've done it with some of my agents, but I don't recommend it, is to create an LOA agreement with the agency or FMO. If you do this, you need to have an attorney who understands insurance contracts that can give you advice. We've got this set up because the LOA agreement is probably one of the easiest ways to do it because the commissions are already coming to the agency. So as long as the agency is continuing their AHIP and product certifications, the commissions will keep coming in. The other option of creating a succession plan is reach out to me, work with 4TBrokerage, allow us to educate you on how to create a succession plan. Again, there's my email, sunny@4tbrokerage.com, my cell phone, 248-330-5102. What makes 4T Brokerage different? Well, the 4 T's in 4T Brokerage come down to these four. One, training, and I'll explain that in a minute. Transparency. I don't contract any agents unless they understand how their contracting works, how to create a succession plan. They understand what my overrides are. I don't hide that from people. They understand that if I get paid $200 for your sale, I'm going to invest a certain percentage of that back into you as the agent. Testimony. I challenge you to reach out to any of the carrier reps in Michigan, mostly in the Medicare space, ask them about 4T Brokerage and Sunny Gurney. None of them will have anything bad to say about me. I guarantee you that's not always the case when they talk about other FMOs. And then when you put that all together, there's trust between 4T Brokerage and our agents. When I talk about training, I love this. I am now starting to see some of my competitors send out these email blasts talking about one-on-one training, succession planning, agency building contracts. Guys, it's great. It's the biggest form of flattery is when someone's copying what you do. I've been in the business for 2 years. Well, I've been an FMO for 2 years, and I'm competing with people that have been in the business for 30 years, and they're now following what I'm doing. So we teach agents how to sell. We work with you on a presentation. We work with you and give you the tools, how to sell the Medicare product, how to do cross-selling of other products. Most FMOs, when they talk about training, they're talking about product training where they bring in the carrier rep to talk about the product. Well, guys, you can read what the summary of benefits are. You can read what the product is. But if you don't know how to set an appointment on the phone, if you don't know what to say when you get an appointment, you're going to struggle to be successful. And if you're putting out money, you need to get that money back in an ROI, and we help you with that. So we do help you with one-on-one training. I have agents call me all the time and say, hey, I need help with Medicare.gov. So we'll set up a quick webinar, 15, 20 minutes, get them up and running, and then we follow up with them down the road to make sure that they're being successful. Technology, we have 4T Connect, and I'm hoping that we have a few minutes for me to show you what's in there. We have Gurney Bucks where we do marketing for you. We do AHIP reimbursement. New agents to the business, we have E&O insurance. That's $25 a month, $75 a quarter. And then for those of you who are just getting going, if you've got an email address that's, johnsmithagency@gmail.com or Hotmail or Yahoo, we help you bring another level of professionalism, and we'll help you get established by working with you on an email address to help you have more credibility in the industry. Proven marketing. We've spent hundreds of thousands of dollars on marketing. We have certain things that work very well. If you follow our systems, there's no reason why you can't be writing 200-300 Medicare apps every single year. All right, 4TBrokerage.com is our website. Please go check us out. Watch my 4-minute video telling you a little bit more about my story. And then, guys, we have about 8 minutes left. I want to quickly break out of this. I want to go in and take you to our 4T Connect website so I can show you some of our platform. So 4T Brokerage, there's a link where you can sign up for 4T Connect. It's for our agents, so you have to be contracted with us. But once you have access to 4T Connect, you log in. Three things I want to show you. One, we have carrier representatives. When I was a new agent, I didn't know who my reps were. I didn't know how to contact them. So we have a place in here for all the carrier reps. They're located in one place. It's all there for you. We also have training. I've done some videos. We're going to add more to it. We've got the carriers that have done their electronic application. They've given us their videos, so you can watch the videos on how to process the application. We've done a 8-video series on how to sell Medicare, talking about the pros and cons about Medicare. Not pros and cons, sorry. Pros and cons of Medicare Supplement, pros and cons of Medicare Advantage, showing you how to teach a client how to pick the right plan for them. We're continuing to add more and more trainings down the road. We have quoting software. We have quoting software for Medicare Supplement, for Medicare Advantage plans. We have quoting software for final expense. We give the tools to our agents. There's no cost to it. The one that I want to take a few minutes and show you the most is our Simply Enroll, which is our Sunfire platform. Guys, Medicare.gov, I used to use it all the time for my quoting because it would remember your client's prescriptions. Guess what? Nowadays, it doesn't. So we have access, all of our agents have access to this, where you can quote and enroll. You can come here, you can create a profile for your client, you can add their prescriptions, and you can save it for later on that week. You can save it for the following year. So let's say we're working on this. I got prospects. I want to Smith. Let's see. So I'm working with Jim Smith. So I find Jim Smith in here. I pull up his quote. I go over here. And what it does is it pulls up all the Medicare Advantage plans in Michigan. The only one that I don't see in here right now is PHP, and I'm going to have a conversation to see how we can get them in here. But you'll see on here that I can pull up their prescriptions, view medications. So all their medications are in here, and then I can hide that and go back in, and I can see based off of cost their cost for the year. And this is not like Medicare.gov where it gives you 10/1 through the end of the year, or the next month through the end of the year. This is the actual cost, where then you can break it down. It'll give you the monthly cost. It'll tell you what's in the deductible phase, what's initial gap, when it's in the donut hole, when it's in the catastrophic. So it breaks it down really nicely. And so you can see in here $748 for the drugs with the HAPS choice Medicare HMO, and then the costs keep going up as you go down into the different options. So you have that option there. You can click over here on prescription drug plans. This will tell you the national carriers. And what I like about this is that with the national carriers, there's actually an enroll button. So I can click on enroll. It's just as simple as a Medicare application that you write in paper. And what you can do is you can then send it to your client. They can either open up an email and sign it, or they can do it through text. And you can do the scope of appointment the same exact way. So I know, like, I did a lot of WellCare last year, their PDPs, and I would meet with my clients, I would do the paper application, then I'd have to get everything together, and then I would have to fax it over to WellCare. Here, I don't have to do that. I click on enroll, I send the application over, and boom, it's done. And then next year, I've got that client's in here, I've got the prescription saved, all I have to do is update their information and then quote them for the following year. So in here, it has, summary of benefits, gives a highlight of what the benefits are with the carrier, and you can also go down below. You can pick and look at the specific carriers that you contract. So you don't have to look at every single one. You can look at just the ones you're contracted with. So it's a really great resource. We have been able to recruit a number of agents recently because of this platform. We've got some large agencies that are looking to work with us because this tool is amazing. So guys, it's been 27 minutes. I appreciate your time. Feel free to reach out to me with any questions. If you would love to have a conversation with me about succession planning or what we might be able to do to help you grow your agency or your book of business, please feel free to reach out to me. I look forward to working with you guys all at some point in the future. Take care, everyone. Have a wonderful day.